Hello, how are you, everyone? Welcome again to today's iCON forum, our online webinar, Take Charge of Your Health, Living Well Together with Diabetes. This is the second day. If you missed yesterday's talk, it's okay. All of the presentations from yesterday have been recorded and will be put on YouTube later on, so you can review them again or see them for the first time. I am Barbara Ho. I am the Chief Nursing Officer of iCON Chinese Division and your host today. Hello, everyone on the internet. So you've come from all corners of the world and to watch you're watching it from one of our hubs. Welcome, everyone. Today's topic, the theme, again, has to do with diabetes. It's an initiative of the UBC Faculty of Medicine. Let's start with Digital Emergency Medicine Initiative. The main purposes are through organizing health seminars, workshops, and using web technology, we can help multicultural the public to know more about prevention of diseases, and also for those who we can instill knowledge for using digital technology to manage your chronic diseases. We hope that we can give you accurate and reliable information for everyone to share. We hope that not only local public can share with this, we hope that through the webinars, we can also spread the knowledge to far and remote places so that everyone can strive to improve our physical health. Okay, so yesterday we've heard a few specialists talking to us. Today we have another four guests to share their knowledge with us. So like I said yesterday, according to the Canadian Society, or Diabetes Society in 2002, there was a survey, the cost of would have been $560 million, and then later on it would be increased to $3 billion and more. So there will also be complications associated with diabetes, for example, stroke, amputation, and other diseases. Today, the topics that we will cover will be on the complications as well as other ways to self-manage yourself, some tips, some technique that you can change your lifestyle in order to manage diabetes properly. So today's speakers, we have four of them. First of all, let me introduce them to you. First one is Dr. Joseph Leong, who is an endocrinologist, and he works at the VGH at the adult endocrinology department, and also is an assistant professor at UBC. After he's finished his undergraduate degree, as well as his doctor's degree in endocrinology, he went to
clinical.
And so with the guidance of Shazan Ahmed, Trisha Tsang, as well as Gloria Leffler, he completed his master's degree in public health at Harvard. And his clinical and research foci are on the traditional care of type 1 diabetes among adolescents. And he works closely with the BC Children's Hospital in their pediatric endocrinology team. The second speaker, I think many of you are familiar if you have participated in our previous fora, and that is Dr. Takasin Yang, who is a registered clinical psychologist, and he has a private practice in BC, and he also is a lecturer at UBC Kwantlen Polytechnic University, as well as Thompson Rivers University. Every month, he hosts a radio program with Deborah Moore on the Chinese radio station AM 1470. The third speaker is Kent Liang, who is a registered pharmacist who has been with us for many, many years. And Kent Liang got his degree in 2003 at UBC in pharmaceutical science, and he is a licensed pharmacist. Now he works at the actually Save on Foods Pharmacy as pharmacy manager in Burnaby now. And he often participates in community activities and talk to the public about health. Ken also hosts a next one. He hosts a program, but I'll let you know later. And then last of all, we have two physiotherapists to talk about exercise. They are respectively Nicole Tai, who was born in Perth, Australia, and grew up in Vancouver. He got his bachelor's degree in nutrition in UT, and also became a registered physiotherapist in Hong Kong. Her partner is Emily Peck. For this talk, she finished her bachelor's degree in physiotherapy in Hong Kong, and she also got her master's degree in sports medicine as well as health science. And she's been in physiotherapist for 15 years. So, hi everyone. Hello. I'm sorry, everyone. There was a bit of a technical issue there, so we will watch Dr. Leong's video clip later. So for the time being, let's hear from Dr. Young about psychological health factors associated with diabetes. Okay, it's all yours. Thank you. How's everyone? I'm Dr. Young. So thank you, iCON, for inviting me this year again to share my input with you. I really appreciate Doctor's introduction. Actually, every year to be able to participate in iCON's fora is a very great honor. So we will talk about lots of things, about lots of information about diabetes, especially affecting your physical health. And today is no exception. Other than myself, you will hear from other speakers on information about diabetes. I'm going to try to take it from another perspective, from another facet to look at diabetes. The most important responsibility for me today is to look at it from a psychological angle, how diabetes affects us. We've mentioned just now that so let's go to the next slide. Let's look at it from a few different perspectives. Barbara has mentioned that economically it has some impact on us, meaning diabetes has impact on us. So how about within the Chinese community? How much impact does it have? So let's have a look how much psychological impact it has on us, and in the end, how we can face it, because there are other issues such as emotional mood issues, how we can deal with them. So first of all, let's look at how prevalent is diabetes, or how prevalent diabetes is in Asia. So we have statistics from recent research. So there's about 500 million who suffered diabetes as of last year, and we don't count the children yet. So there are, in other words, it affects 20 to 79 years. People who are 20 to 79 years of, it's like 500 million of them. So there will be 600 million in another 10 years or so. So you can imagine the people who are affected is so numerous. At the beginning of this year, there's a research at the United States from the CDC. They wanted to look at how many people in the United States of America suffered from diabetes, as they found out that 1 in 10 people have diabetes. 1 in 10 people has diabetes. So how about Chinese? Let's have a look at, because we want to address this issue in Canada. So in Canada, there's about 38 million in population, and the Chinese in Canada, there's about 1.8 million, which is about 5% of the total population in Canada. If you look at BC alone, in BC, there's 5.2 million in population, and the Chinese in BC, there's 600,000, which is about 12% of the population in BC. So there are a lot of Chinese who are living here in BC. So let's assume, let us estimate that, okay, Canadians are healthier than Americans. So about 8% instead of 10% of people who have diabetes. So if that's a conservative estimate, so within BC alone, among the Chinese alone, there may be about 144,000 people who have different types of, 48,000 people who have different types of diabetes. Other than these numerical indices, there's another tendency that we have discovered. The new cases, the growth of new cases have increased very rapidly. There's a study from UT in 1996. Among every 1,000 Chinese, there was a 1.3 new cases. That was in 1996, but in 2005, there's like a 15 times increase to 19.6 new cases among 1,000 Chinese. So if you can look at the more recent research, you will see that the rise has been even greater. So why do we have to understand these figures? Because actually, it's closely associated with our mental health, diabetes. So among those who have diabetes, about 41%, think of it, it's about half of them will have different types of mood issues, psychological issues. And there's another tendency. Only 9%, less than 10%, if they have mood issues, they will be referred to psychological treatment. So about 90% of those who have diabetes, they have not had a chance to be referred to that. So you can imagine how large a population that is. So diabetes is described as one of the chronic diseases that can affect or have more demand on our behavior and mental thinking. So just think what we have to watch out for if we have diabetes, about eating, our diet, our treatment, our medications, booking our finger. So all of a sudden, so many things that we have to do. So you can imagine how much stress it creates on us physically and mentally. So you can understand, you can appreciate. There is research that shows us that diabetes is closely associated with some mental disorders. For example, depression, insomnia, anxiety, eating disorders, and et cetera, schizophrenia. So it's about between twice and 3 times as much as normal people who don't have diabetes. So we cannot neglect the impact diabetes has on our mental well-being. So the next question, how can we cope with these obstacles, these stresses then? So do you want to know? Well, I have a suggestion. Maybe this can help you control what the stress created by diabetes. So let's give you this tip. Retirement, right? I'm sorry to talk about. Oh, actually, no, Dr. Leong is trying to trick the interpreter. It's not retirement. It is about no worries. Try not to worry. So by retire, it means it actually is an acronym of 6 letters. RETIRE, because I wanted to retire, but we're not talking about retirement, we're talking about an acronym. So let's talk about what these letters stand for, RETIRE. So it's not retire, but it's actually less worries. So let's see if we can deal with diabetes if we use these 6 techniques to manage our stress, okay? Okay, retire. Number one, the first R is reframe. So reframe meaning reorganize our thoughts. What does it mean? So for example, sometimes after we have this condition, then we paint ourselves in the corner. So we have put ourselves into a trap collectively in terms of our thought. And it's no snowballs. For example, interest rates are snowballing. So if you want to have less worry, and what do you have to do? You have to, okay, let's reduce the color here. There's a black and white color. So instead of looking at things from other extremes, whether it's black and white, so look at it. Let's take the middle path. So don't look at it from the worst case scenario. But that's in a culture. In culture, we tend to be more pessimistic. So remember when you were a child, and if you didn't get 100 marks in your test, your mom and dad would say, "Oh, you must have been lazy." So that's how our thinking, that's how we've been brought up. So if you want to control our stress, what can you do? You can reorganize your thoughts. Okay, the second technique is, how about examining our facts, re-examine the facts. Now, whenever we make any decision, can we first, okay, collect some data, some evidence, some facts? Start with that. Can we learn not just to jump into a conclusion out of a whim from our emotions like fear, anxiety, and all that? So instead of knee-jerk reaction, we can look at the facts and before we behave anything. So does it mean that if we are in a depressed mood, we have to give up everything? No, it doesn't mean that. If you are in a depressed mood, that is mood. So whether you give up, whether you can do that or not, it's a behavior. You can decide on whether you can do it, how you can behave, and then you can jump into conclusion. That's so simple. So when we make decisions, what do we rely on? Common sense. We have to rely on common sense. We need to use logic to analyze whether such behavior, such decision, what are the advantages, what are the disadvantages, what will I gain, what will I lose? That's how you make decisions. It's not because of knee-jerk reaction impulse. So you can try whether you can re-examine those facts. The third technique is take a detour. Now, how do you take a detour? Simply put, so focus on those things that you can control, especially if you have some information about diabetes. Sometimes you will focus on things that you cannot control, right? So really, whatever you did yesterday is a fait accompli. You cannot change it. So you cannot control lots of things that happen around the world. So why don't you use energy and focus on the present and what you can do, what in terms of behavior, what you can change, and what are the results, what are the outcomes that can be more effective. Okay, the fourth technique, I'm going fast, right? So inform. What? Recalculate your fears. Okay, so I'm sure that the stress, when you have stress, well, even if you won the 649 jackpot, you still have stress, right? The good news is that such stress is not to be shouldered by one person. So you can share that with your family, with your friends, share the stress. maybe sometimes you can talk to somebody about what you think inside in your heart. So maybe you cannot change the facts. At least you can face the reality, the stress that's created by this disorder. So how about, but people say that I don't want to spread negative energy to my friends or energy because they are already stressed enough. So, okay, even though you don't have someone to talk to, you can write it down, write a journal, record on your cell phone, right? So you can have an outlet for your moods, for your frustrations, for your sentiments. So that will reduce your stress, right? So the fifth one is what we can do, recalculate. Does it mean that whatever we fear is things that are so risky as we have thought? Not necessarily. Why don't we try to use another way to ask questions? If you were to ask me, hey, Dr. Young, well, will there be will terrible things happen? Well, my answer is for sure, it's possible. You know why? Because everything is possible. Lotto max, those things, what do they call in the United States? Those jackpots, they're difficult to win. It's improbable, but it's still probable. It's still possible because the only answer is everything is possible. So what can we do then? Change your way of asking questions. Let's try to ask questions like this. So if those terrible things were to happen, what are the possibilities? So for example, there are side effects for taking injections or medications. If you were to ask me, will there be side effects? I said, yeah, of course it's possible. Anything is possible. Anything. So for me, actually, the right question to ask, what is the probability? So it all depends on the risk factors. So everyone has different risks that they face. So that's how you make decisions. For example, if I take a flu shot for the last 10 years, I've had allergies to that. So we know that. So there are risks involved with taking flu shots. So you will decide whether the effect is greater or can offset the risks. So the good news is what the risks that we imagine may not be factual risks. So the last technique is we have to evaluate starting from the 1% rule. Say if you want to eat healthily tomorrow, do exercises starting tomorrow, wake up early, go to bed early, to be a happy person, maybe I won't be able to do that. But can you start with 5 minutes of exercise every day and then add 1 minute every day? So by the 6th day, you can do it for 10 minutes. So if you do it gradually, one step at a time, 1% increment every day. So cumulatively, it will become a lot more. So if you can try this new retire 1%, okay, less worries, the 6th technique. So even worse comes to worse, you cannot change your diabetes, but at least you won't be facing new obstacles for having diabetes, especially mood obstacles. Like I said before, diabetes and our mental blocks are closely associated. If at least you can remove or control that block, even though if you cannot control diabetes, you can still, you win half of the battle, right? So as a caregiver then, what can you do? Well, first, you can learn more information about diabetes, for example, today and yesterday. So when you learn more information about this, then you will have less fear about diabetes. So the fear is reduced. The second thing is so try to talk to the patients more. Like I said before, sometimes the patient feels okay, I want to block everything away. I don't want anyone to be impacted. So they don't take the initiative to talk to you, to talk about their stress. So we can try, when we care for them, talk to them more. And then when we talk, well, there are technique to do that. So we have to know how to listen, and not just, oh, you can blah, 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 and solve their problems. No, although, yes, you can help them solve their problems. This is one way of showing your care. But for sure, this is not the only way. There are many situations that a patient needs someone to listen to them, to listen to what they want to tell them. And it's not necessarily like for them to solve their problems for them. So maybe we can try that. Listen. The third thing is the caretakers must learn this, how to take care of themselves. So this is a marathon, sometimes ultra marathon. So this is a chronic disease, it's an ultra marathon. So you cannot cure it overnight. So no one can run a marathon in 1 hour, for example. So sometimes you take a rest, you need to take a rest. You have to find a briefer before you can finish this 42.2K of distance. The fourth thing is, and this is one of the most important, which we must remember, there's no way that we can be responsible for another person's moods, whether the other person is happy or not. Sometimes it's not for us to control, right? So as a caregiver, a lot of times what we have to learn is don't shoulder everything upon yourself. So fortunately, there are many resources for learning, because this is an advanced age for technology. You can find lots of information. For example, this interactive zone from Hong Kong, where you can learn a lot of information. And how about here in Canada, in BC, we have different information that our government can offer. For example, the iCON is one of the most important resources. So I hope that everyone can, with this information, lead a healthy, happy, and less worry life to face diabetes. Okay, thank you very much. Okay, thank you, Dr. Yang. So actually, it looks like that diabetes is something that can affect your mental health well-being, because it creates a lot of stress, especially for those who live with you in the home, who care for you, who cook for you. All of these there's some sort of stress to some extent or another. But for example, they don't like to take medications. They don't like this type of diet, or abstain from this or that. So it creates stress for everyone. So many thanks, Tigers and Dr. Yang, for sharing with us so much information about the mental stress.
Linda takes her mom to the doctor, picks up a prescription, stops at the grocery store, and gets her back home in time for a nap. She's a family caregiver. Michael has a partner who leaves the water running, forgets to eat lunch, doesn't like to take pills, and can't get dressed without help. He's a family caregiver. Jaspreet coordinates her sister's care, drives her teenagers to soccer, and holds down a full-time job, all with a health condition of her own. She's a family caregiver too. In British Columbia, there are more than 1 million unpaid people taking care of friends or family members with a chronic disease, disability, or mental health or age-related challenges. They're keeping the care recipients happier and healthier. They're keeping them out of the hospital longer. And they're saving the healthcare system millions of dollars. Family caregivers deserve a medal. But here's the thing, family caregivers need care too. Oh, they might not think they do. I'm fine, they say. Really, I'm fine. But they're looking exhausted and feeling stressed, and they're not smiling or having fun as often as they used to. Maybe they're not fine, and maybe their own health is starting to suffer. Family caregivers are a vital part of the healthcare team. Their health is just as important as the health of the person they're caring for. So if you know someone who's taking care of an adult family member or friend, if you're a healthcare professional who sees the person beside the patient, if you're a family caregiver yourself, let us help. Family Caregivers of British Columbia offers free education, support, and a voice for family caregivers in BC. We have a caregiver support line and support groups. We'll help you navigate the healthcare system. We offer webinars given by experts on topics like caregiver health and wellness, family dynamics and caregiving, communication and assertiveness skills, sharing the care, and navigating the healthcare system. Our online resources will help you better cope with the demands of caregiving. After all, while you're taking care of your loved one, who's taking care of you? Family Caregivers of British Columbia. Let us help.
Okay, you may want to watch that family caregiver get more information and see how they can help you. So now let us go back to Joseph Leong's video. Dr. Leong is going to talk to us about how to control blood sugar and the importance of preventing complications. Because we know that diabetes patients have also complications that can affect their body. So let us listen to Dr. Leong now.
So hello, everybody. Yes, I'm Dr. Liang. I'm the diabetes doctor working at VGH. Yesterday, we already listened to Dr. Ma, Gloria, our dietitian, and Laura, a diabetes nurse. And we have heard the informative and in-depth information about diabetes. And today, let's continue. So today, we are going to talk about diabetes, how diabetes affects the different parts of our body. And also, we will learn about how to prevent complications. And finally, we're going to talk about what treatment options, what are the ways that we can do to treat diabetes. So yesterday, Dr. Ma talked about what diabetes is. Diabetes causes the body to have high blood sugar. And diabetes may not display symptoms. And sometimes even when the blood sugars are very high, patients may not detect it or may not feel any symptoms. However, if symptoms show up, sometimes it can be fatigue, thirst, feeling weak, having headaches, dizziness, or frequent urination. So if these symptoms do come up, it would be better to make an appointment with a specialist and check the blood sugar and see whether you have diabetes. For diabetes, there are different types. Mostly, when we hear, would be type 1 diabetes, type 2 diabetes, and gestational diabetes during pregnancy. So every diabetes is slightly different, and usually among people of advanced age, we would see type 2 diabetes. So today, I'm going to concentrate more on type 2 diabetes. For type 1 diabetes, usually requires the use of insulin, and other medication may not help. And usually it is diagnosed during childhood. And today, we are not going to touch on type 1 diabetes. So for type 2 diabetes, it can lead to many different complications. So why are we so concerned about diabetes? It's because of all these complications because of stroke, heart attack, and also high blood sugar and diabetes can affect mental health and also cause other suffering. So our next presentation by Dr. Tageson Young will present on that aspect. And then I'm not going to touch on this. Diabetes can cause damages to our blood vessels. So in our body, there are bigger blood vessels and smaller ones. If our bigger blood vessels are being damaged, so it would lead to heart disease, heart attack, stroke, or even wounds in the feet being infected and other complications, and even causing amputations. So that's why we are very concerned about diabetes and be very cautious. So to pay attention to our blood sugar level. So you can see in this picture, this is a blood vessel which is totally unblocked, and blood can reach freely to our heart muscles and to our brain. However, if for a diabetes patient, so it can affect the inflammation in the blood vessel. And you can see here, there is accumulation of fatty deposit blocking part of the vessels. If the blood vessel is completely blocked, then a stroke or heart attack may happen. And diabetes, how can it affect smaller blood vessels? And diabetes can damage small vessels and leading because of inflammation and causing damage. In our body, where can we find smaller blood vessels? The kidney, the nerves, and also the eyes. So for the kidney, if it is affected, then it will be kidney failure. And sometimes dialysis may even be required. And for nerve damages, then if there is damage, then it may cause pain and numbness in the hands and feet, and for the eye, causing blindness. And therefore, diabetes, deserves extra attention by us. And then I'm going to talk about how to prevent complication later on. So how do we diagnose diabetes? How do we discover? So by blood work. You can do it by poking your finger in your doctor's clinic, or you can go through blood work, and then from the blood work, it can be diagnosed. And for diabetes, high blood pressure, together with high cholesterol, these three things can together cause different complications. So that's why these three things have to be closely monitored, and then you should ask your doctor to examine them. For diabetes complications, it is very important to prevent them. There are three things that we should have in mind. The first thing is to screen for diabetes complications. So if you do not know you have complications, then how can you properly deal with it? And the second thing is to treat diabetes complications. The third one, actually, this is the best way to deal with it. And it is to manage diabetes well by controlling the blood sugars. So if the blood sugars are better controlled, then diabetes complications may not come as soon, or they even do not appear at all. So let us talk about the screening. How can we screen for diabetes complications? There are several ways. The first one is for eye examination. So if you have diabetes, but you haven't have your eyes examined for a long time, so you should be going to the ophthalmologist and to check whether diabetes is affecting your eyes. And for people who are 40 years or older, then you should be doing ECG, because through an ECG, irregular heartbeat or signs of heart disease can be picked up. And also you should keep a constant monitor of your blood pressure. Hypertension together with high blood sugar together can cause blood vessels to have inflammation. As I said, you have to keep your cholesterol level checked, as well as your kidney function and then urine tests. And every night, make it a habit to check your feet to see whether there are lesions or whether there are wounds, and whether you have to put on a Band-Aid, or so you have to take care of that. And for those people who are still smoking, please quit, because smoking would also cause inflammation of blood vessels. And then when inflammation occurs, then it will bring about more complications of diabetes. The second is to treat diabetes complications. So how can we do that? Yes, there are ways, but depending on what kind of complication. For heart disease, there can be oral medication, there can be procedures, and when it is really serious, let's say the blood vessels are all blocked, then sometimes you have to do bypass surgery or angioplasty. So these ones have to be referred to a cardiologist and then ask them for their advice. And if you have a kidney failure, then you should be seeing a renal doctor. And when it is really advanced, dialysis may be required, so it would be quite a burden. And the best thing is to avoid dialysis. And when there are wounds in the feet which are infected, then sometimes sometimes antibiotics may be required. And when it is really serious, then amputation will be required. So of course, this is something that we would like to avoid. And for the eye, so if the diabetes is affecting your eye, then sometimes there may be surgery required, and sometimes injections can be done into the eye. Then, of course, this is the best thing to avoid that. However, if you do have complications because of diabetes, there is always ways of treatment, and hoping we can prevent blindness, amputation, or dialysis. And one thing very important is to control the diabetes and the blood sugars, and to manage it. So we have heard from yesterday that one of the ways to manage diabetes is by diet. So yesterday, Gloria, the dietitian, already gave us some tips. So today, later on, we have Emily and Nicole, and they are a physiotherapist, and they would let us know what kind of exercises to do, which can help manage diabetes and avoid diabetes complications. And there are many medications for diabetes, and some can even help with prevention of diabetes complications. So today, I would like to introduce different kind of medications. And also there will be Kent. Kent is a pharmacist, and he will further go into details about medications, about their side effects, and so on. And now I would like to quickly go over some major medications treating diabetes. So which one we can choose from? The first one is Metformin. Metformin is an inexpensive medication. This medication is usually first prescribed for patients who are newly diagnosed of diabetes. The pill is a little bigger, but it is quite effective and can help with lowering of the blood sugar. This is pretty good. And the side effects will be sometimes some stomach ache or a little bit of diarrhea. So you have to pay attention to that. The second type would be glyburide or glycoside. And these two medications are smaller and is also inexpensive. And it can help the pancreas to release more insulin. And the side effect will be low blood sugar and sometimes causing weight gain. So, if you may gain a little bit of weight, and then you have to be cautious. And these two medications are newer medications. So in the past 5 to 7 years, they come up to the market. And finally, in the past 2 years, the BC government has already approved it and covered it through pharmacare. And for these two medications, they are more expensive. However, they do not only control the blood sugar, they also helps with avoiding and preventing complications. So the frozen. So this is a kind of pill. So you take one or half a pill every day. This medication can help not only with the blood sugars, but also help lowering blood pressure, to control your weight, to protect your heart, your brain, and even your kidney. And so this is a very good medication to use. And the side effects may cause urinary tract infections. The other one is called the semaglutide or Ozempic. For this medication, this is an injected medication, but you do not require injection every day, but only once a week. This medication can lower the chances of heart attacks and strokes. And this also can help manage your weight. And I use these two medications a lot on many of my patients, and the effect is very good. And this linagliptin, actually, I do not use it very often, but why do I share it with you? It's because this medication is useful to patients who are experiencing kidney failure. As I have said, metformin, glyburide, glycoside, and the empagliflozin, they are not suitable for patients on dialysis. But linagliptin, well, this is suitable. This is more expensive. Therefore, we do not use it very often. However, the government covers that. For linagliptin, semaglutide, and linagliptin, so the government requires special authorization. Usually they would like to see a patient trying on metformin or glyburide without effect before they approve these ones. And finally, we have insulin. For insulin, so it is to be injected 1 to 4 times a day. And if it is required, usually it means the diabetes is a little bit more advanced, and the side effect will be low blood sugar and weight gain. So if you do need insulin, its treatment effect is very good, really helping you to lower the blood sugar. Many of my patients require the use of insulin. And then if you're on insulin, then you have to be cautious and pay attention to signs of low blood sugar, especially for those who have to drive. The best thing to do is to check your blood sugar every time before you drive. Okay, now today, we have mentioned some of the things that were mentioned yesterday. So what is diabetes, which is causing high blood sugars? And also, we have talked about different types of complications caused by diabetes. So that's why we have to have close concern, because we would like to prevent complications. There are many different ways to treat diabetes. So as yesterday, we heard that one way is by diet, and today we are going to hear Emily and Nicole sharing about exercises, which ones are suitable. But sometimes we do need medication. And for newer medications, well, they do not only help control the blood sugars, they also help prevent weight control and then prevent the onset of other complications. So these medications can protect the heart, the kidney, and also the blood vessels. Okay, so this is what I have to say today. So let's go to the next presenter. Okay, thank you, Dr. Liang, who shared in details about diabetes and the possible complications and what treatment options. So earlier on, Dr. Liang has already touched on some medication, but because diabetes patients many a time would when they are confirmed that there's a chronic disease they have to face, they have to be prescribed medication or even insulin. And today we are very glad to have Glenn. I say our because Kent has been working with iCON for so many years, numerous times regarding medication management. So we have Kent today again, and we will look at proper medication management in regard to diabetes. So I'll pass the time to you, Kent. Oh, hello, everyone. So it's me again. So I'm Kent Liang. I've worked with online for many years. And today I would like to talk about some medication management regarding diabetes. So I will also share other information with you. So the first thing, the purpose today is to understand the importance of following medical treatments and the important proper use of oral medication and insulin injection. And the next one is to learn about pharmacare coverage in relation to diabetic supplies. And also we try to understand how to prepare. And then, so also the cost of medical supply for diabetes, because we have to keep testing our blood sugar level, so we have to understand. And also, well, one of those days when we have a sick day, then how can we prepare ourselves to manage a sick day? So these are the things I'm going to talk about. So the first thing is, the most important thing, the goal for treating diabetes is there is no cure of diabetes, but the most important goal is to control it. So to maintain your sugar level at a normal level, and then so that you can maintain your glycemic control level. And then if it can be maintained at a normal level, then you are no different than a person who does not have diabetes. And then we also have to prevent or minimize the risk of acute or chronic complications, just like Dr. Liang has said. So if you can if you do not control it properly, there will be a lot of complications like infection of the feet and other infections. And also our goal is to control and prevent other risk factors such as hypertension, obesity, or dyslipidemia, because these conditions can also lead to other complications. So for people who are having diabetes, if you could control these, then you could further avoid complications or other risky diseases. So Dr. Liang has already talked about medications. There are many different ones. They can be taken orally or by injection, and some injections can be insulin or even non-insulin. And there are two main types. The first type is type 1 diabetes, and the second one is type 2 diabetes. And sometimes for pregnant women, gestational diabetes. So usually we focus on type 1 and type 2 diabetes. For type 1 diabetes, very briefly, because of the cells in the pancreas have failed. They cannot produce insulin at all. So for type 1 diabetes patients, they have to receive injections of insulins because the pancreas does not produce any. So for that, there will be rapid-acting insulin, and some will be short-acting, and some will be intermediate-acting, and some is long-acting. So for the doctors or the certified diabetes educators like pharmacists or specialists in diabetes, they would, according to different situation individually, prescribe different types of acting, because your lifestyle can be different and the diet may be even different, and the amount you eat may be different. So there would not be a set dosage. So it will be prescribed specifically to the individuals, because if you have too much insulin, then it will cause low blood sugar. If it's not enough, then it cannot control the blood sugar. So everyone is different. Now for type 2 diabetes. For type 2 diabetes, because the pancreas is not totally failing, so in certain extent, the pancreas is still secreting insulin, but you may have to rely on some medication. One common one is metformin. And there will be glyburide, glycoside. And the second type of the glyburide or glycoside, if you have too much of that, it will cause low blood sugar. And therefore, controlling the dosage is very important. For injections, besides insulin, there will be Ozempic, just like Dr. Liang has mentioned. And there are many injectables. They are much newer, and then they are a little bit more expensive. And there are other oral more different types, like pioglitazone or rosiglitazone. So you may say, so many different oral medications, which is better? So I can tell you that actually every medication is a benefit and its shortcomings. And for one medication that's good for one patient may not necessarily be suitable for you. And therefore, your healthcare provider team will determine on your personal situation to choose the best choice for you. And therefore, you have to understand using medication to treat diabetes is to control blood sugar, to control it as closely to the normal level as best we can, and therefore it's impossible to treat it completely, and also we would like to prevent complications. Some people don't like medications, so they will try to cut the dosage. They're just worried, oh, these Western medication will cause a lot of side effects. However, if you do not use the correct dosage and have the desired effect, then there may be complications. Because when complications come up, it may be a little bit too late. So therefore, it is very important to follow the doctor's directions and then follow the label on the bottles, and don't just change the dosage yourself. Otherwise, if you may fail to control your blood sugars and increase the risk of having complications. So different medications, we have talked about different ones, the metformin, glycoside. So actually, what is the mechanism of them to work in the body? So of course, the major goal is to control the blood sugar, but their mechanisms can be different. So as I said, one medication which is good for a person then may not apply to you in your case. And also the doctor may also look at other health conditions that you have, because if you have other health conditions, some diabetes medications have to be avoided. Of course, there will be side effects. So unless your body cannot withstand the side effects, otherwise you should be following the doctor's direction and then following the label of the medication. So don't say, I would like to avoid the side effects and then I avoid the medications. So that is not the right thing to do. Every time when you fill up a prescription, we'll let you know about the side effects. But even after you have heard about this, don't worry too much. So this is our obligation to tell you, but they may not really apply to you. But this is our duty to do so. We are not to scare you. And this is only something that is possible, but not necessarily probable. So even when they do come up, and then if it is too unbearable, then talk to the doctor to see whether you have to stop that. So this is one thing you have to avoid. Do not stop the times of dosage. For example, if the doctor tells you to take it 2 times and you cut it in 1, and then you are telling yourself, oh, today I feel good, so maybe I can cut my medication, because sometimes you may not have any symptoms when you have diabetes. Usually, if you have low blood sugars, you may feel it. But if you have high blood sugar, you may not know, only when you are testing your sugars. And there is a poll question for you. So I would like to see what you think about it. So what if you forgot to take your previous dose of medication? What do? Let's say in the morning, you have forgotten the morning dose, and now is afternoon. So what will you do? I've got 3 choices for you. A, take the forgotten dose immediately, even if it is close the time to take the next dose. That means, oh, I forgot the morning dose, so I'll take the 2 doses together. And B, will be just skip the dose completely. I'll just take the afternoon dose. And C will be depending on the medication you're taking and the blood sugar level at that time on whether to take that extra forgotten dose. So please give your answer. Oh, yes. The answer is now, of course, it is C, because you have to depend on the medication and your blood sugar level. Why is it? Well, diabetes is very characteristic, has its own characteristics. Let us look. Oh, answers. So roughly 30% for every answer, but actually the correct one would be C. So for diabetes is quite different from other diseases. It depends on the current blood sugar you are at. So let's say if you have forgotten, and then you first of all try to examine your own your body. Do you have any unusual symptoms? Then if you don't, then give yourself a poke. Test your blood sugar. If everything is normal, then well, it's easy. Just take life as normal, and even if you have forgotten one, it's okay. Your blood sugar level is normal. However, now when you test your blood sugar, it is very high, and then you should have had your insulin. Then you should give yourself an injection right away, or even change the dosage. Then you usually should ask your doctor, so should I have a different dosage if my blood sugar is very high? So diabetes management is a little bit different from the management of other diseases. It depends on your physical condition and your blood sugar at the moment. And therefore, the answer is C. And if you're still not sure how much I should take, whether I should skip, so I think you should go to your pharmacist or to talk about this with your doctor. And many people, as said, would inject insulin because oral medication may no longer manage and control the blood sugar. So for injections, so there are a few things we have to pay attention to. So injecting insulin, now we use, we call it injectable, or some we call it the pen. So look at this, what I'm holding up. So a pen, so it looks, yeah, they come in the form of pens. So before you have to assemble the pen, and then you have to use the insulin, and then you have to assemble the needle, you have to screw it on. So when you're injecting that, making sure that all the injection dosage, making sure it is accordingly to the label, because if you inject too much or too little, then it will affect your blood sugar. If it is too high or too low, there may be risks. So how do we check? Look at the pen I have. So at the end of it, there is a number. So if you dial it, so check it 2 times, making sure if you're dialing, if you should be injecting 38, make sure you do, and then leave it to 38. And then don't just casually change it to a number. And then once when you have it injected, then you cannot extract it from your body. So before you give yourself the injection, make sure that you check very carefully. And also do not repeat the use of the fingertip of the needle or the needle. So this is one of the needles. They are supposed to be used only once. Now you can see, you have to open it, and you can see there is a needle inside. So don't open it yet. So this needle is just right to be assembled into the insulin pen. And you can see it will punch a hole, and it can connect to the insulin. And after dialing the desired unit, then you open the cap, and then you can inject it into your fatty part of the body, holding for 15 seconds or so to making sure that the insulin has gone into your body. If you keep repeating using the same needle, what would happen? So if you keep doing this, then this needle may bend. So what if it's bent? The insulin in that case may not be able to go through the needle and go through into your body. So don't just think of costing money. I know. So a box of needles can be $40 or $50, but don't repeat using the needle. If you keep screwing that on, if the needle becomes bent, then it cannot lead the insulin into the needle head and the needle points. And then if you keep using that, that means repeating the contact of this point into your fatty tissues, then the needle is not as sharp, and you will feel pain and increasing the risk of infection. And do not inject in the same site. If you do so, you are stimulating your fatty tissue, and a lump may be formed, and there will be the blockage of the lymph nodes, and you would find a lump there. It seems that the skin is getting thick, and if you keep repeating in the same area, it will reduce the absorption of that medication, and also it is not good to the skin, and increase the risk of infection. So please remember this. Now, I'm talking about testing of your sugar. So traditional ways will be using these test strips. So a bottle like this, usually there are 100 in one bottle. And usually when we buy one bottle of these test strips, the blood glucose machine will be free. If you buy it from one company, then they will give a machine free of charge. So you just take it out, and then you take your machine, you put the strip into your machine. Immediately, the machine turns on automatically. So wait for about 5 seconds. then it will prompt you to put some blood. And then you have the machine comes with a device to poke your finger. Usually not much blood is required. A very small amount of blood is enough to test your sugar. So this needle, so this one again, you should not be reused because this will increase the risk of infection. And then after you have inserted the needle, pull it back, and then just like pulling the trigger, and then you can poke your finger. And it's a very slight poke with 1 drop of blood coming out. And so you can put it close to the machine, and it will the test strip will take up the drop of blood, and then in a few seconds, the blood sugar level will be indicated. So this is really simple, and you don't have to be very, very complicated. And there are many different machines. It can be connected to your smartphone. It can be connected to your computer. But if you say, oh, I'm not very familiar with a smartphone or computer, so some very basic function blood glucose machine would take care of your blood testing very effectively. So this is the most traditional one. So in the past few years, then we have something called the continuous glucose monitor. And this is a very interesting product. It can tell you the blood sugar minute by minute. So currently we have 2 brands. One is just Freestyle Libby, and the second one is Dexcom. So actually they are called the continuous glucose monitor. So you can know your blood sugar any time of the day, and there is no poking of your finger. And there is usually a sensor, which is a monitor, a device for monitoring. Usually we put it behind the upper arm. It is there all the time. So how is it done? There is a very small needle, not too sharp. I tried it on myself. And then when you put it on, it doesn't cause pain. But once when you have done it, it's stuck. It sticks into your body. So as long as for 14 days, even when you're showering, it stays on. And you can tell your smartphone, and that there is a device, you can buy it separately, and you can immediately see your blood sugar at that moment of time. This is really helpful to patients with type 1 diabetes because they have to know their blood sugar minute by minute because their cells in the pancreas have failed them. So they have to control the blood sugar very precisely. So the traditional strips are on the market. So for $100 bottle, so it's around $75 or $85. So when I prepared this slide, that was the amount, but maybe now it is a bit more expensive, maybe reaching $90. And there are 100 strips, and the blood glucose monitor is free. This is the most traditional one. And earlier on, I said the continuous glucose monitor. And as I said, every 2 weeks, you have to change the sensor. And the price is from $100 to $120. Yes, it's a bit more expensive, but remember, you can tell your blood sugar anytime, right, without having to poke. And between the two, they for the Dexcom, maybe $345 a month, and then change every 10 days. And you have to buy a transmitter. So if you work it out, so they are pretty much close in regard to pricing. But if you would like to have it covered by the government so that you can be covered using the continuous glucose monitor, the government is covering the second one, the Dexcom G6. Now we are talking about something more practical, about money, okay? So how much is the government paying? So actually the government is taking care of diabetes patients. But well, we can just buy any strips or any continuous glucose monitor. No, yeah, there will be an annual limit. So how do we decide on the annual limit? Depending on your diabetes situation and also the way of oral medication. So depending on the treatment. For example, if you're using insulin, but you do not use a continuous glucose monitor. So maybe type 1 or type 2 diabetes. And then every year, there will be 3,000 test strips. 3,000 test strips. So if you work it out, then 136 days, then it will be, so let me see. So every day you can test about 5 times because for people doing insulin, it is already a further advancing stage in the diabetes. And therefore the government allows more testing every day. For people who are using a continuous glucose monitor together with insulin, then the government I'm talking about test strip, okay? So annual limit will be 200. So how come it's 200? Because you're already using a CGM. You can have continuous information about your blood sugar and you do not require the 200. But why does the government still allows 200? Because sometimes, you know, when you don't wear the monitor properly, or sometimes there may be technical issues, then you can still go back to the test strips for your blood sugars. So that's why the government still allows 200 for annually. And for people who have milder diabetes, and then you have oral medication, and well, you have a hypoglycemia. That means what does it mean? For example, you have glyburide, this kind of medication. These medications cause hypoglycemia more often. And for these kinds of patients, the annual limit is 400. So the next one. Now for patients taking oral medication together with a low risk of hypoglycemia, for example, you're not using glyburide or glycoside, and the government only allows the annual limit of 200 test strips. So for people who actually don't rely on medication, they will control their diabetes by a diet or lifestyle, then the government would have an annual limit of 200 that will be covered. But you have to understand that if the government is covering such test strips, however, it only when you are diagnosed by the doctor that you have diabetes. So when and how can I be receiving these free covered test strips? So you have to go to a education class, and then you have a certificate, then you are approved to be covered by this annual limits. So for these CGM, the continuous glucose monitor, it can be covered by the government. You don't have to attend classes, but you can apply for authorization, but only through the doctor. So when the doctor says that this is the thing that is suitable for you, the doctor can write to ask for authorization. And usually for the beginning, authorization is for 1 year. And after that, it can be repeated every 5 years. However, it would be you are willing to follow, but to be followed by the healthcare team of diabetes. And some people may say sometimes we may have a cold, you may have a flu, or unfortunately you have COVID, or maybe stomach upset. So your lifestyle that day will be different. You may not be able to eat as much, and therefore the amount of insulin or oral medication may be different. And in that case, how are we going to prepare for that? So when you get sick, you have to pay extra attention to your blood sugar. You may have to test more often, because once when we are sick, we may have more hormones and then changing the blood sugar level. So don't just stop the medication you've been having. The best thing is to ask your pharmacist, and the most important thing is to look at your blood sugar levels. And of course, if you check your blood sugar every 4 hours, that will be even better. So have more water so that you will not have dehydration. I know, yeah, it's easy when I say it, but I keep saying, keep a close monitor of your blood sugars. For the time being, you might have to stop certain medication, but that has to be under the advice of your doctor. And of course, in order to prevent for a sick day, to receive all the immunization and then see the doctor when required. So this is all I have for today. Okay, thank you, Kent. This is a lot of things to learn about having medications, especially for diabetes patients, especially if they have hypertension or other health conditions. Then there are too many medications to deal with. So for some people, they may even have Chinese herbal medication, and that would add on to the complication. So, yes, I think the best thing to do is to share with your doctor, your nurse, and the pharmacist, and then don't keep it to yourself and then secretly pick on some secret prescription or some secret formula. Although we do receive a lot of training of the Western medication, so we don't know too much about the herbal medication. So we have to ask herbalists, and to avoid a conflict in medication. Thank you, Kent. So later on we are going to have Q&A, and we are going to invite Kent back onto the forum and to answer questions. So most people are watching on their own. Okay, thank you all. Now, the next speakers, well, it's time to move. Okay, maybe you can see if Emily and Nicole can introduce something for you to move about. So how to stay active, whether you're a diabetes patient or whether you're well with no disease, everyone should stay active and even further do exercises. And today we are happy to have two registered physiotherapists to explain to us how we can stay active. Okay, it's your time, Emily and Nicole.
Thank you. Hi, how's everyone? So you have learned a lot of things just now, a lot of information. Now, our next topic is to stay active. How do you stay active? So first, I want to introduce ourselves. Hi, everyone. I'm Emily Pack. I'm a registered physiotherapist in Hong Kong and in Canada. And I also do acupuncture, and I'm a yoga instructor. I've been doing that for more than 10 years, so I'm quite experienced. So I want to share with you some knowledge about exercise when you have diabetes. Hi, everyone. I am Nicole Tai. I'm also a physiotherapist here in Canada. I'm also a IMS needling practitioner. I am not a yoga instructor. It's a misleading title. I'm only taking a course in acupuncture. So I'm trying to mix both Western and Chinese methods. So let's go on and begin our talk. Today we're going to share with you some objectives First, I want everyone to understand how it benefits those who have diabetes, and how do you do exercise safely, and how do you prevent injury when you do exercise. So let's talk about the benefits of regular physical activity. Now, exercise, I'm sure you know that there are many benefits for that, other than the promote your blood circulation, and also promotes your physical health and your functions, internal organs functions, cardiovascular functions. The most important thing is to increase our immune system capacity, and also it reduce our stress for us women, and it can reduce weight for those who are women to reduce weight. So there are many benefits. Right. So let's look at this graphic and explain to you what are the benefits of exercise. Actually, diabetes can affect a lot of our internal organs and create a lot of complications, and can affect our heart. So more exercise means less risk of complications. Also, exercise can control our blood pressure, control our cholesterol, as well as improve our glucose level. So of course, more exercise means more strength and better stamina, and help us improve our blood circulation. So you know that exercise has so many good benefits, so do more exercise then. Now, if exercise is so important, how do you do it safely then? Now, let's have a look then. Right. Those who have diabetes, when you do exercise, you have to watch out for these things. Number one, you have to monitor your glucose regularly. So if it's too high or if it's too low, that's not time to do exercise. And we should bring along some snacks with us all the time. For example, crackers or some candies. So to prevent that all of a sudden your blood sugar level decreases to a low level, then you have to take some snacks. You also watch out for any adverse symptoms. So if you have them, then you have to stop immediately. And before exercising, you have to take some low glucose foods. And finally, you should avoid strenuous exercise. And actually, there are other things to remember. When there is emergency, when you feel dizzy, you have pallor or sweat, cold sweat, then you should stop your exercising immediately, and find someone to help you around you, and also talk to the family doctor about your conditions. So what kind of exercise should we do? Actually, there are many types of exercise. So for those who have diabetes, there are the aerobic and strength exercises that are suitable for them. Now, what are aerobic exercise activities then? So that means that you have to do it for 20 minutes continuously. If you sweat, if you are short of breath, that's aerobic exercise activities. So jogging and swimming, for example. So we have a suggestion. Every week you should engage in at least 150 minutes of moderate to vigorous exercise. That means that what is moderate? That means you can still talk while you're doing it. And vigorous exercise means that you cannot talk easily when you do it. You cannot sing. So karaoke is not for exercising. So another benefit for doing exercises is it promotes heart, lung, and blood vessel health. So more aerobic exercises means that you can walk longer, you can hike longer, and you can do your house chores more relaxed, more easily. So, and another type of exercise is muscle strengthening. Suggestion is do it 2 to 3 times a week. For your major muscles, you should use push, pull, or lift machines. So these exercises can help strengthen your muscles as well as your endurance. Well, it's power strengthening. So you should use heavier weights, and you can do reps like between 6 and 10 reps, or even up to 20 reps. For endurance exercise, you can use lighter weight, and you can do more reps, say between 8 to 10 reps. And this kind of muscle training exercises can strengthen your muscles. For example, when you wash your dishes, or you cook, or you hold your grandchildren, so that would also strengthen your bone health. So how much exercise should we do? Actually, in Canada, there's the Heart and Stroke and Association, as well as Public Health Canada. Their recommendation is that for each week, you should do it at least 150 minutes of moderate to intensity aerobic activity. Don't do it for too short. Don't stop at 5 minutes. You should go for at least 10 minutes. And so you can do 10 minutes and do it for 3 sets every day. So all in a week, you should accumulate 150 minutes or more. And also in a week, you should spend 2 to 3 days doing moderate to high intensity muscle strengthening activities. So we were talking about 100 minutes. That's the minimum. So if you want better effects, you should do more than 300 minutes. So remember, so doing exercise is not trying to be very strenuous, trying to kill yourself. You should do it gradually to increase the time on spending exercise and the intensity, and do it gradually, slowly, and not like doing it all in one go. And that you don't have to prove that you are Superman. So aerobic training guideline. So that means you should do exercise and you sweat, and you can have more endurance, and create shortness of breath. So how much is good? So at least 3 to 5 times a week, and the intensity should be a moderate intensity. And every time it should last for at least 20 to up to 60 minutes. So the type of exercises is to train your large muscles, for example, your arms and your thigh. And so you should do aerobic exercises, for example, running, dancing, swimming, and hiking. Those are aerobic exercises. If we do exercise, how do we know how intense it is? So we have something called a modified walk scale. So there's a scale of between 0 to 10. So 0 is when you're watching TV on the couch, that's 0. 10 is when you want to catch the bus and you can't catch it. So that's maximal exertion. So I hope that when you do exercise, you can go from 5 to 7. That's the appropriate intensity. So when you do exercise, how do you know how fast your heart beats? So we use a primitive way, so we can try that for ourselves. So use 2 fingers and put it on your wrist near the thumb, and then you can try that at home for yourself. So just press it very lightly. Can you feel your pulse? So if you feel it, then okay, let's just quietly look at your watch, the clock, and count to 10 seconds, and count how many beats it beats in 10 seconds, and times 4. That means for each minute, that's how many times you beat. So there are more advanced methods. For example, there are watches that have these functions. So you wear a watch, and automatically it can check your heart rate. So when you do exercise, of course, our heart rate is faster rather than your heart rate at rest. Let us talk about another way. So how about a talking test? So the intensity of exercise can be measured by, for example, moderate, light, moderate, and intense. So light meaning that you can talk, you can sing, you can chat without any difficulty. That's light. And vigorous means that when you're exercising, you're short of breath, you can't talk, you can't sing. So that's vigorous. Well, actually, what we hope to achieve is somewhere in the moderate level, meaning that, okay, it's not so difficult, but you can talk, maybe you cannot sing, but that's the level that we want you to achieve. Right. So some of us want to know, is mahjong, playing mahjong and exercise? Well, actually, you can talk while you play mahjong, right? So actually, mahjong is not an exercise. So please, when you do exercise, so do those that are moderate to vigorous before you can see any results. Something that is very important, so listen carefully. How do you prevent injuries when you exercise? When you do it safely, don't pull your muscles, don't pull your hamstrings. So first, we must, before we do exercise, do warm-ups and cool down afterwards. In other words, you stretch your neck, you stretch your arms, you stretch your legs before you really start doing exercise. So for the warm-up and the cool down, spend at least 5 minutes doing that so that your body is more flexible. And try to avoid doing activity in extreme weather. If it's too cold or if it's too hot, that's not appropriate for those who have medical conditions to exercise. Remember to stay hydrated when you do exercise, and also carry some fast-acting carbohydrate food. For example, crackers or biscuits in England, or candy bars or granola bars, power bars, those will help. And how do you prevent injuries? So you should have your medical identification. So you have your medical ID card. You should know your medical history. Say maybe those who have diabetes may have heart problems. So you should adjust your exercise level accordingly and choose those that are appropriate for your condition. Say if you've never done any exercise before, don't try to do vigorous ones right off the bat because that may cause muscle achiness, and that will last for a few days afterwards. So then it will scare you off and you don't want to do exercise for at least another 2 weeks. So try to adjust your intensity so that your body can tolerate it, and then you can do it for at least 20 minutes a day. Another thing is foot care. That is very important. So we will talk about more later. And when you feel discomfort, stop. And then you talk to your family doctor afterwards. So everyone should be aware that diabetes affects our nervous system or our sensitivity. Say our arms and our hands and feet, they are not so sensitive. At least sometimes when they get hurt, we don't know. So watch out for your foot or your feet, especially before you do your exercise. You should have adequate foot care. So you should use some warm water to clean the injured foot, especially between toes. After you've cleaned them, you should use a towel to soak it, to dry it, all of the foot, especially between the toes. So your foot should remain dry and not damp, and you should also maintain the skin health of your foot. So if the climate is too dry, if there are places that are damp, moldy, so you should use some lotion, skincare products, and cream, and even baby powder to maintain your foot's health. So there are places that you can, you may not be aware that they're injured, so you can use microscope to magnifier to watch for those wounds. So if you see any kind of wounds or redness or any bleeding, remember, don't go to the water, don't go to the pool, and don't go to the beach especially. Now, our toenail care is also important. So if your toenails are too long or if it's too untidy, so you're prone to injuries. So when you clip your toenails, be careful that you don't hurt your toenails or your toes actually. So the best thing is to wear socks all the time. Even if you're indoors doing exercise indoors, it's good to wear kind of thick socks and anti-slipping socks so that you're not so easily injured. We also told you that when you do exercise, don't do it when it's too hot because you can get a heat stroke or you can feel discomfort. The last diagram shows that don't do it bare feet, especially when you are doing on a uneven terrain, going to a beach or some grass. If you walk without wearing shoes, maybe there are sharp objects right there, or maybe there are obstacles that you don't notice and you can injure yourself. Right, so we have some recommendations for doing home exercise. You can do exercise at home. You don't have to go outdoors all the time. So what our recommendations are is that at home, you should do at least 15 minutes of exercise, which include stretching, warm up, say 5 minutes of stretching. So if the weather is kind of cold, you should do it for longer, to maybe 10 minutes of warm up, say 10 minutes of stretching. So actually our upper torso, our upper arms, you can make circles with that, and be sure to move your shoulders, your shoulder blades, so that your body gets warm very quickly. So do it forward and backward. So that's how you do warm up. So also your lower body, your lower limbs, you can march in place, and so that's how you warm up. And your lower back, your waist, you can go do circles like doing the twist, and then do it slowly. Don't do it too fast. So that's how you use your muscles effectively. And also when you do exercise at home, try to do jog in place or run in place. So if you want to go outside, you can go for a walk and that sort of thing. So you can see that the lower left corner, there is the calf raise exercise. Actually, what I wanted to check is our calf is actually our second heart, because our heart pumps blood to the calf, and when it contracts, the blood goes back to the heart. So this exercise is very helpful. The last thing is stretching. Stretching, you can stretch your lower back. When you sit for too long, stretching is very important. So I hope that in the near future, we can share more exercise with you. So when you're listening to our talk at home, I hope that everyone can keep doing exercise, stay active, and so keep an active life to ensure that you have good health. It's time for questions and answers. First, I want to invite all of the presenters of today back here. We are very happy to have Dr. Joseph Leong, who is joining us from Portugal. That is actually 11 o'clock over there. Thank you, Dr. Leong, for joining us all the way from Portugal. Let's say hello to Dr. Leong. Oh, thank you very much. And then I have some questions here that I want to ask you, and I want to ask everyone.
So the first question is for Dr. Liang from Portugal. So this friend would like to say that I don't know how to read this name, Ozempic. So this causes lowering of his body weight. So is consuming food in drinking beverages of a higher protein content would prevent that. So he is a male of 5'7" and well, 150 pounds. So would it be too the body weight is too low? So maybe Kent can further talk about this. Ozempic itself, yes, it is used to lower your body weight, and if your body weight is already on the lower side, then I think you should talk about this with your family doctor or your specialist, whether you should continue with this medication. For some people, then if your body weight further goes down, then yes, this may not be a good fit for you. So your question was, so if you are using Ozempic, whether you should be consuming fluid or higher in protein or carbohydrate to boost up your body weight so that your body weight can be more stable. Well, I don't think this is necessarily so. For your situation, it is best to talk to your doctor and discuss about whether this medication is the best fit in your situation. And well, maybe the doctor can refer you to a dietitian in the diabetes center who can look into the kind of food you are consuming and seeing whether the effect of Ozempic and the other oral medication and also the content of your daily meal, and look into all this detail to see whether it is an appropriate diet. Thank you, Dr. Leong. So Kent, anything to add on? So I agree. I think the most important thing is to talk about this with your doctor and also with the dietitian, because if the body weight drops too much, maybe this medication is not a good fit for you. All right. Now the next question is also for Kent. So regarding the Freestyle Libre sensor, so there is a chip inside. So would it affect the growth of cancer cells? So would it be affecting that? So according to my knowledge, yeah, it would not, because the chip is actually outside, so just sticking onto your skin. And it is not absorbing anything from it. So it is only a sensor. Oh, so then, so you can use it with peace of mind, because sometimes we worry about radiation, right? Using a smartphone in your ear all the time, then you might have cancer in the adjacent area. So I think this friend has this kind of worry. Yeah. So thank you, Kent. And Nicole and Emily. So there is one question for you. So I do 15 minutes a rowing machine, just like, rowing. So every day I do this. So is it aerobic training, or is it just helping with muscle strengthening? So actually, so every day doing 15 minutes on the rowing machine is excellent, because it has two ways to help. Because rowing machine itself, there is weight resistance, so training the back and the arms. And then if you do 15 minutes, it will be aerobic. But for aerobic, at least 20 minutes. And therefore, if this friend can just further work 5 more minutes, then this will be an excellent aerobic exercise. So if you do a rowing machine for 20 minutes, then it can be counted as weight training as well as aerobic exercises. Keep the good work. All right, so keep doing it. Any exercise is better than none, right? So yes, doing exercise is better than none always. So let's go to Dr. Liang again. How do we prevent diabetes, fasting, and after meal? I think the question is, what is the target blood sugar for fasting and after meal? How do you prevent complication or so actually Dr. Ma has talked about this. So actually yesterday Dr. Ma had talked about the numbers, and today, although we do not talk about it, and usually depending on a few factors. One of it is the hemoglobin A1C. So it should be 7 and below 7 for people who already has very good control of the blood sugar control, but have early signs of complications, then you will have to have further lower the A1C to 6.5%. However, for people who are older or have other health conditions, and there are a lot of chances of having hypoglycemia or having cancer or even dementia, then the A1C target could be a little bit higher, let us say of 75%, 7.5% or 7.8%. So this is possible. So depend on other health conditions. And also you have to look at the overall situation. So if we would like to talk about the blood sugar, but not the average value, yesterday Dr. Ma was saying 7-Eleven, right? Remember that, right? So usually for people who are not having diabetes, the blood sugar would never shoot up higher than 11.1. And I think the 11 is a magic number. It's a good target. Whenever you see that you are higher than 11, then you should consider ways of better controlling your blood sugar. There is one question for Kent. So the coverage, I think it must be pharmacare or MSP. So the medication, Jardians. So the doctor can apply for authorization, and for your personal insurance plans, maybe, but it has to follow the recommendation of pharmacare. They may have to apply for special authorization. So different coverages may cover this medication. So one question too, using the continuous glucose monitors, would there be any side effects causing allergy on the skin? Most people don't, but unluckily if you do, well, just like medication, some medication can be used by many, but allergic to a small number of people, then try not to repeat the same site. And if you do, then it will increase the risk of sensitivity. So early on, you have said that there are two types. One is Freestyle Libre, one is the Dexcom G6, right? So recently, there seems to be another one announced by the government. The government would cover Dexcom G6, right? Yes, as earlier on I said that, but it has to go through a special authorization by the doctor because you have to meet the different criteria. So if that coverage, is it totally free or partial coverage? So just like medication, so like the test strips or Dexcom, it works accordingly to the total family income. So if when your family deductible has gone beyond the amount, then Dexcom would also come into play, the coverage, yes. Okay, so yeah, it seems that Dexcom is mentioned, but not Freestyle Libre. So yeah, this one is not, but not sure about down the road. So if patients have to use these devices, because personally, I've tried using the Freestyle Libre, and actually it is really convenient. And it seems it's just a mosquito bite. So, well, in the beginning, I feel, well, it is interval, yeah, uneasy, no fun having such a thing on your arm. But however, you don't feel you can go exercise, you can swim, you can put on your best dresses or your outfit. So some people put it in more obscure places where it's not as noticeable, and you can tell your blood sugar any time of the day. And for some patients whose blood sugar fluctuates a lot, then this is really, really very useful to them. And sometimes poking fingers, some people, well, they've been having diabetes for so many years, they may lose sensitivity in the fingertips. And even the needles are fine, and sometimes even blood does not come up. But so, yeah, they have to poke several times. And sometimes they have to poke the side of the finger because the skin has gotten thicker. And this is very, very undesirable. So for the continuous monitor, then this is good. Yeah, a little pricey, but this is good. I've come across patients who says, oh, I don't want to be poked. I don't want to know. So I think this further affects the management of the diabetes. So I think this is a new invention, a new tool is actually very helpful. So I hope that the government can have more coverage taking care of patients who require the use of these things. Thank you very much. Okay, let me see. One friend would like to ask a question. So, let me see. Maybe this one did not attend our forum yesterday. So what's the difference between diabetes and type 2 diabetes? So actually, so it can be explained in very complicated way, but in briefly, so type 1 would be, so the cells in the pancreas have failed, so it produces none of insulin. So these people would have who are having type 1 diabetes because they don't have other means except insulin to treat the type 1 diabetes. For type 2 diabetes, well, for Chinese people, because it happens more commonly among us, and usually we can control it by exercise, by proper diet, and sometimes oral medication, and this can be controlled. But when it is very much advanced, then injection of insulin is a good way. So I think this is the easiest way to differentiate the two. And one question from a friend who says a person is 60 years old, blood pressure is good, and the fasting blood sugar is 5.3 to 5.8, which is pretty good. So the low density cholesterol is 3.28, and the HDL is 1.29. And the triglyceride is 1.07, and the total cholesterol is 5.26. So these numbers, are they good? So are they, yeah, anything that I have to pay attention to? Well, I think LDL is, we are talking about the cholesterol, right? So for cholesterol, after the blood work, the normal range usually should be 2 something below. But once when a person has diabetes, then it will increase the risk of complication like heart disease. And And in that case, usually we would like to target the cholesterol to be lower, for example, the LDL. So for people who does not have a person who does not have diabetes, it may be 2.5. And then for a person having diabetes, it would be under 2 or even under 1.8. And in that case, this will further prevent complications of diabetes like stroke or heart attack.
So overall, other than diabetes, you have to know whether you have other medical conditions. So the lower you get, the better. So especially, I'm not talking about blood pressure, diabetes, and cholesterol. If you combine them all together, the chances of having complex complications are higher. So you have to control them together. If you have 2 of them, or if you all 3, then you should talk to your family doctor or your specialist to control, to stabilize those levels. Okay, thank you, Dr. Leong. Dr. Young, there's a question for you now. So, Dr. Young, the question is there? Let me, I have to read it verbatim. Are there any lower rates of counseling? Okay, psychological services offered in Cantonese. Any services that are low cost? It's not that easy to find for the time being. We don't have too much of information about that, but there are community resources, community services which offer such support. Sometimes you can look at places like inside a university. There's doctorate students or someone who is doing practicum. If they speak Cantonese, then they can offer such services at a low cost for you. So the good news is that over the last few years, because of the pandemic, the government seems to be paying more attention to psychological health, mental health. So they may want to increase their resources for that. So I hope that if we keep on going that way, so people can use that service more. So I don't know whether you know or not about CMHA, that is the Canadian Mental Health Association. They used to have a bounce back program for some people who probably were suffering a little bit of depression. So I don't know whether they have this program still. I haven't heard about it for a long time. I think they still have it. So you need referrals from your family doctors, and then you have a self-study program. They will send you information, and then you can pursue on your own. I believe that someone will call you and follow up with you to check your progress. So I think it's still there. The resource is still there. So yeah, you can find that out from the association. Thank you, Dr. Young. Finally. So Nicole, there's someone who likes to practice Tai Chi. Is that a good exercise? Well, a Tai Chi is a good exercise because Tai Chi, after all, you move about, you move your major muscles, and sometimes you sweat from practicing Tai Chi. So it's a good aerobic exercise. I agree. So don't underestimate Tai Chi. So even if you practice it for 20 minutes at a time, it helps your muscles all over the body. It's not a strenuous exercise. It still helps your cardiovascular functions, and you can feel that you breathe better. It's good for your respiratory system, your circulatory system. So for elders and for diabetic patients, Tai Chi is a good exercise. I didn't know that Tai Chi was considered an aerobic exercise. That's good. The next question is for Kent. This would be the last question because of time time constraints. So how about vitamins and herbal medicine taken together? Best not, because vitamins, sometimes there are calcium contents, so it can offset or reduce the effectiveness of some medications. And there's also some minerals that have chemical effects. So if you're not sure, you can ask your pharmacist and they can tell you whether you can take them together. Okay, fine. So we still have more questions coming in. So our staff will collect all the questions that have been posed over the last 2 days. I know a lot of people have asked about sugar intake. So our dietitian is not here today, but yesterday she told us a lot about our diet, carbs, sugar intake, and all those things. So over these last 2 days, all these presentations have been recorded and we will post them on our iCON site. So within the next 2 weeks after we have done some editing, you can watch them again. If you miss anything, then you can make up for what you missed or what you missed. So thank you, our panelists, our presenters, especially Dr. Leong, who is spending time, who is losing some sleep. And in future, I hope that we have opportunities to answer more questions. So we will create a new session just for answering those unanswered questions. So first, I want to thank all of you here, and I also want to thank our Ministry of Health, patients as partners to support our iCON work. And please remember, before you leave us, scan the QR code and to complete the survey. And in future, when you receive mail or email, please help us complete the survey. And I also want to thank, oh, yes. All right. Okay. Here we have this QR code. It's a different QR code. So if you are taking part for the first time, you have not been registered in our email list, you can scan this QR code to join our iCON mailing list. And in future, whatever activities we have, we will let you know in the first instance. I want to thank our community partners who are, well, there are very many, you can see. They are Vancouver Coastal Health, Fraser Coastal Health, CMHA, and South Vancouver Neighborhood House, Richmond Cares, Family Caregivers BC, UVic, Self-Management BC Institute on Aging and Lifelong Health, Vancouver Divisions of Family Practice, and Vancouver Public Library, as well as Villa Cathay Care Home and Richmond Gives Caregiver Hub, Mosaic Caregiver BC. Thank you to all of you to help us promote and advertise this program to the public out there. And I also want to thank our media partners. They include Fairchild TV, Omni TV, Ming Pao Daily News, and as well as Singtao Daily Group. And I also want to thank, over the last 2 days, the hubs that were open, have been open to the public. They include CLC Health Center, Jackson Lamb Adult Daycare Center, Day Center, South Vancouver's Neighborhood House, and Villa Cathay Media Partners. Those are our media partners, our hubs. Hey, we also want to thank our speakers as well as the speakers from yesterday. And we want to thank the hard-working interpreters because we have live simultaneous interpreting from Cantonese to Mandarin and Cantonese to English. So we want to thank Shiny, Hunhui, Benny, and Josephine, who interpreted for us. So we've come to the end of our forum today. So if you want to watch those presentations again, as well as other presentations, you can go to our www.iconproject.org website, as well as icon.support@ubc.ca to review those presentations. So if you think you're sick, so treat it early, especially if you have chronic diseases, hypertension, diabetes, or high cholesterol. You should try to learn more so that if you do have those conditions, then you can manage properly. So in future, we will have workshops, we will have other presentations. I hope that you can watch out for those in our webpage, as well as the information that we will send you. We'll see you again in future. Thank you for your participation. Bye-bye.
Technology's changed our lives. Think about how we bank and book holidays. Now, we still rely on professionals, but we're doing more ourselves, using phones, computers, and apps. It's not extra work, it's extra control. We like that. And that's where healthcare is headed. Now, we've always fixed simple health problems ourselves, asking friends and neighbors first. But who hasn't wanted more reassurance? That usually meant a trip to the doctor or hospital. Today, that's changed. We have instant access to incredible health information, however we want it, not to mention unbelievable tools and services. Just check out HealthLink BC. HealthLink is a 24/7 service that helps patients manage their own health. But what it really does is empower us. Let's start with HealthLink's phone service. When you dial 811, you're connected to a health system navigator who guides you to the expert you need fast. A nurse, a pharmacist, a dietitian. Experts who are trained to deal with problems over the phone and with access to 130 languages, no less. Imagine how useful that would be if it's the middle of the night and your baby is running a fever. Instead of going to emergency, you can get a health professional to walk you through proper treatment right away, right at home. Online at healthlinkbc.ca, there's medically approved information on thousands of health topics, tests, and procedures. You can check symptoms, find local resources, learn how to maintain a healthier lifestyle, even email dietitians for advice. That's exactly what the anxious mother of a child with food allergies did. She went online, got connected with a dietitian, and together they created a meal plan for her child. Now there's a mobile app that has lots of the same information. With its mapping function, you can even locate the hospitals, clinics, and pharmacies closest to you. Of course, there's always the BC Health Guide Handbook. You can find it at your local pharmacy. The handbook walks you through 190 common health concerns. It's super handy. In fact, there are even stories of people from BC using it in the US to avoid going to the hospital because they didn't have insurance. So you see, these are great services. 811 helps about 1,200 people a day across BC, and healthlinkbc.ca gets over 10,000 visits every day. These services take patient empowerment to a new level, supporting the biggest untapped resource in healthcare. Us. That's a connection worth thinking about.